Welcome back to Have More Babies. Today we're diving into something really important, a topic that honestly can sound quite alarming for any parent: encephalitis. Think about it, inflammation in a child's brain. It's serious stuff. But like always, our goal here is to walk through it together, turning that worry into understanding and hopefully informed action. We're looking closely at encephalitis in children, the astonishing reality of brain inflammation, and how to manage it. And our information for this deep dive comes from a fantastic resource, Omega Pediatrics. They provide such valuable insights into children's health. So we're here to demystify this condition. We'll explore the causes, the symptoms you need to watch for, and what steps you can actually take. Because knowing what you're dealing with, that's your best defense. Okay, let's start right at the beginning. When we talk about encephalitis, what exactly are we talking about?
Yeah, that's the perfect place to start because, the word itself sounds pretty intense. Put simply, encephalitis is an inflammation of the brain tissue. What's really notable, I think, is how something relatively rare overall can still have such a huge impact, especially on the very young, like children and also the elderly. So while it's not super common, understanding this basic definition brain inflammation, that's really the first step to getting a handle on it. And often, though not always, it's kicked off by some kind of viral infection.
Okay, so inflammation, often viral, but not always viral. That's a key distinction. So if it's brain inflammation, what are the different things that can actually trigger it? Is it usually one specific cause, or is it more of a mixed bag?
It is definitely a mixed bag. And that's a really crucial insight here. Encephalitis isn't one single disease. It's more like an umbrella term for brain inflammation that can come from many different sources. And this complexity, well, it highlights why getting a fast, accurate diagnosis is just so critical.
Yeah.
It's almost like being a detective, right?
Yeah.
Finding the specific cause dictates the whole treatment approach. Now, on the viral side, which causes a lot of cases, we often see the herpes simplex virus, HSV.
That's the one that causes cold sores.
Exactly, yes,
Yeah.
the very same virus. But in rare situations, it can travel to the brain and cause inflammation there. Then you have enteroviruses. That's a bigger family of viruses, including things like Coxsackie virus, which you might know from hand, foot, and mouth disease. Poliovirus used to be a cause too, but thankfully vaccinations have made that extremely rare these days. Another important group are the arboviruses. That basically means arthropod-borne viruses.
Arthropod-borne, so like bugs.
Precisely. These are transmitted through insect bites, specifically mosquitoes and ticks. So just being outside in certain areas, certain times of year can unfortunately be a risk factor.
Yeah.
But it's not just viruses. We also see cases where the body's own immune system makes a mistake.
How does that happen?
It's called an autoimmune reaction. Essentially, the immune system gets confused and starts attacking healthy brain tissue instead of protecting it. It's quite complex. And then, less commonly, certain bacterial infections can sometimes lead to encephalitis. Things like streptococcus, which usually causes strep throat, can, in really severe infections, spread and cause inflammation in the brain.
Wow, okay, that's a really broad range of possibilities. Insect bites, common viruses, even the body attacking itself, it really shows you the challenge. With so many potential triggers, how does a parent even begin to spot the signs? What are those key symptoms that should really raise a red flag, especially when kids get sick so often with, regular bugs?
That's such an important question, isn't it? How do you tell the difference between something serious like this and, say, the common cold or flu that kids seem to catch all the time? While some early signs might look familiar, there are definitely indicators that point to something much more serious going on. Often a high fever is one of the first things parents notice. Maybe a fever that's really stubborn or spikes very suddenly, and that often comes with a severe headache. We're not talking just a minor ache, but a really debilitating headache, where the child might have trouble moving their head or interacting.
Okay, so high fever, bad headache, but lots of illnesses have that. What else?
Right. The things that really signal the need for immediate medical help, the things that differentiate it are the significant behavioral or neurological changes. You might see irritability that's way out of character for your child, or extreme tiredness, lethargy, maybe confusion in an older child. Some children might even have hallucinations, seeing or hearing things that aren't actually there. And then, critically, there are the neurological symptoms. This could include seizures, which are always a medical emergency, or maybe difficulty speaking, slurring words, or even sudden weakness or paralysis in an arm or leg. It's really the combination of these signs, especially the neurological issues and those really marked behavioral shifts, that screams, get help now.
It really sounds like just being super aware of those drastic changes from their normal self is key. No parent wants to miss something like that. The idea of sudden behavioral changes or, goodness, seizures, that's incredibly scary and would definitely make you act fast. So let's say a parent sees these alarming signs, they rush their child to the doctor or ER. How do the medical professionals actually confirm it's encephalitis? What does that diagnostic process look like, especially with all those different potential causes?
Well, connecting back to what we said earlier, getting that timely and accurate diagnosis is just paramount for effective treatment. It really sets the course. Typically, doctors start with a very thorough clinical exam. They pay close attention to the neurological side of things, checking reflexes, coordination, mental clarity, things like that. After that initial assessment, there are usually several specialized tests. One really crucial one is a lumbar puncture, sometimes called a spinal tap. Yeah, this involves carefully taking a small sample of the cerebrospinal fluid, that's the fluid around the brain and spinal cord, and analyzing it in the lab. They're looking for signs of infection, inflammation, maybe even the specific virus or bacteria. Gives a lot of direct
We're
information.
looking right at the source.
Exactly. Then imaging scans like an MRI or a CT scan of the brain are also really vital. These scans create detailed pictures inside the head, letting doctors actually see if there's inflammation or swelling in the brain tissue and where it is. And finally, blood tests are usually done too. These help look for signs of infection systemically and can sometimes help pinpoint the specific cause, like looking for antibodies the body made against a virus, or even bits of the virus itself. All these pieces together, the exam, the spinal fluid, the scans, the blood work, help build that complete picture needed to confirm encephalitis and, importantly, figure out why it's happening.
That sounds incredibly thorough. It's good to know there's such a multi-pronged approach to figuring this out, especially when it's so serious and has so many different faces. So, once that diagnosis is made, what happens next? What are the treatment options? Is it sort of a one-size-fits-all treatment, or does it really depend on what caused it?
No, it definitely depends heavily on the underlying cause. That's why nailing the diagnosis is so critical. For example, if it's confirmed to be viral encephalitis caused by the herpes simplex virus, HSV, then specific antiviral medications, like a cycloverve, are usually the first line of treatment. They work directly against that virus. But if the cause is found to be an autoimmune reaction, remember, where the body's attacking itself,
Right.
then the treatment shifts completely. In those cases, doctors use immunotherapy. The goal there is essentially to calm down or redirect the immune system to stop it from mistakenly attacking the brain.
Interesting. So, targeted treatments based on the cause. What about managing the symptoms themselves?
Absolutely critical. Regardless of the cause, a huge part of managing encephalitis is symptomatic treatment. This means directly addressing the problems the child is experiencing right then and there to keep them stable. So things like controlling high fevers, using medications to prevent or stop seizures, and sometimes even needing help with breathing, maybe respiratory support. And because this condition is so serious and requires such close monitoring and often specialized care, hospitalization is pretty much always needed. Often that means care in an intensive care unit, or ICU, where they can really manage all the vital functions and watch for any complications. It really underscores the severity, but also shows the level of dedicated support available.
It's definitely reassuring for parents to know that there are specific treatments depending on the cause and that intensive care is there if needed. Okay, so we've covered what it is, why it happens, what signs to look for, how it's diagnosed, and how it's treated. That's a lot of crucial information. But the big question for parents is always prevention, right? What can we actually do to try and lower the risk? Are there proactive steps we can take?
Yes, absolutely. And this is where parents can feel, a real sense of agency. While you can never eliminate risk entirely for everything, there are definitely key prevention strategies that can significantly reduce the chances of getting many types of encephalitis. First and foremost is vaccination. Keeping your child up to date on their routine shots is huge. Immunizations against viruses like measles, mumps, and rubella MMR vaccine dramatically cut the risk of those specific viruses causing encephalitis. It's a really powerful tool.
Okay, vaccines are key. What else? You mentioned those arboviruses from insects earlier.
Right, so insect protection becomes really important, especially during warmer months or in areas where mosquitoes and ticks are common. This means using insect repellents that are effective and safe for kids, dressing them in protective clothing when they're outdoors in grassy or wooded areas, and just generally being mindful of avoiding bites. And then there are the simple, everyday things that make a big difference, good hygiene practices.
Like hand washing.
Exactly. Regular, thorough hand washing is incredibly effective at preventing the spread of many common viruses that could potentially lead to complications like encephalitis. So you see, the powerful thing about prevention here is that it's often about layering these strategies. It's the routine vaccines, plus being smart about insect bites, plus consistent basic hygiene. There isn't one magic shield, but these habits together really do build a strong defense against many of the potential causes we've talked about.
That's such a great reminder. It feels empowering to know that many of the basic health habits we try to instill anyway are genuinely protective. So, wrapping this up, what does this all mean for you listening right now? Ultimately, understanding encephalitis, even though it sounds scary, actually empowers you as a parent. It's not about being frightened, it's about being informed so you can recognize potential signs and act quickly if you ever needed to.
Exactly. And it makes you think, doesn't it? How many common childhood symptoms, a fever, a headache, might sometimes, rarely, mask something much more serious underneath? This whole discussion really underscores just how complex children's health can be and why that parental vigilance, backed up by solid knowledge, is probably the most powerful tool you have.
Couldn't agree more. Being informed helps you advocate for your child and work effectively with medical professionals. Now, for more detailed information, comprehensive pediatric care resources, and insights on encephalitis and many other important child health topics, we really encourage you to visit omegapediatrics.com. They are the source for today's deep dive, and they have a wealth of information available. That's omegapediatrics.com. And if you found this conversation helpful, please do us a favor. Like this video, subscribe to the Have More Babies channel so you don't miss future deep dives, and please share this with other parents or caregivers who could benefit from knowing this vital information. All right, that's all the time we have for this deep dive on Have More Babies. Thank you so much for tuning in and joining us. Stay informed, stay well, and we'll catch you on the next one.
Take care, everyone. Goodbye.